This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch. Featuring Dr. Molly Fantasia, the Ph.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch right here on Talk Radio 1210 WPH.D. It's Sunday morning, 8 o'clock. It must be time for Health Watch.
Time to stay healthy. That's if you
right.
are.
That's right. Good to have you with us as always. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We talk about everything here related to Innovative Medical Associates, the who, what, when, where, why, and how, and why they do what they do. It's very simple. And we welcome your participation at 1-855-839-1210, 855-839-1210. If you have a question for Dr. Molly at any time during the course of the show, feel free to call in and ask the question, and she'll be able to try to help you out with that. 855-839-1210. And as always, Dr. Molly, it's a good day to talk about your health.
It sure is, John. Thank you.
We want to talk about what you do and why it's important. And we'll get into a lot of different things.
Sure.
But basically, what's the basic philosophy of Innovative
Well,
Medical?
we're a group of like-minded providers, healthcare providers. So what we believe is we can do anything, meaning the physicians can do anything any other physician can do. If you need a prescription, you have high cholesterol, they can write for high cholesterol meds. If you have to have high blood pressure, we can write for high blood pressure meds. But what we believe is we would like to limit the side effects, not just from the condition you may have, but also from some of the solutions, the pharmaceutical solutions. And in that case, what we like to do is bring in natural products that may help, and our delivery system tends to be medical hydration. We may use oral nutraceuticals or natural substances as well, but the delivery system that we've seen that's worked the best for most of the patients who come through our doors is the hydration, medical hydration.
And not the stuff you buy in the health food store.
Not always, John, as well you know, because you were living proof of some of the junk you did. And,
yes.
I was happy that we were able to help in that regard. And it's interesting because many people who listen to this show, and listen to you on your other show, actually, also tell me they are very big proponents of a more natural approach to their medical challenge. And they come in with a lot of nutraceuticals, bags and bags full. And sometimes it's crazy, as you know.
Sometimes it's several shopping bags.
Exactly. And this they do in the free consult. And, John, I love the free consult, as you know, and you've seen me in there. And I'm supposed to be given 20 minutes, but many times I just can't do it. Because not only are they bringing in so much of this stuff, many times they're bringing in their pharmaceuticals that contraindicate the nutraceuticals that may intensify some of the nutraceutical work. And so what we have is a big problem.
Let's talk about the initial consultation.
Sure.
And what you actually do, or what do you talk about?
Well,
that's really the question.
Here it comes, John. The bottom line is most of the folks who come to see me, I get a fair share of people for well care, want to come in, see the doc, because they just feel like they're a little bit off. They may have fatigue, something. But most of the times I come in with people who have struggled with lots of challenges prior to this. And they've seen physicians all over. And lately we've been talking a lot about Lyme disease, a highly complex condition, and post-Lyme. So let's just take that for an example. In a condition like that, when the patient comes in, I want to get the previous blood work. I want to hear the medical history. I want possibly for them to bring in some of their old medical records so I can do a little historical look at this and see where they are right now. This kind of thing, John, takes a bit of time because, again, when you have conditions that are autoimmune in nature or the cancer protocol conditions that people come in for the supportive care, we need to look at all of that and sort of make a game plan that's specific for that individual using the medical hydration.
So it's really a combination of you talk to them about maybe the health food store, and then but really the health food store is not the main focus.
No, I want to really put them on their road to a better quality of life. And in order to do that, we have to look at where they are in this moment. How did they get there? I mean, I see people have come to me by seeing the very best specialists out there for particular things, infectious disease, right, for Lyme. And they've done every single infectious disease protocol that's known. They've done the antibiotic. They've done immune enhancer. I mean, they've done everything. Well, why are they still feeling so bad? We've got to hone in on that particular symptom. How is it affecting their overall quality of life? And what can we do to help them improve? Look, we're not going to cure this condition, but we are going to make you substantially better in terms of quality of life.
I had an interesting conversation the other day with one of your new patients.
Okay.
And here it is that she comes from New York.
Oh, yes.
And it was just so interesting how she came to you, but somebody highly recommended you, and she came, and here she goes. She's just doing well so far.
Right. That happens a great deal, John. It's because people are, I like to call this sometimes desperation medicine, because what they do is they're desperate to have a quality of life. And, they're very educated. People who listen to you on your other show and listen to this show, they're educated people.
Yes,
they know,
yeah.
I'm not in the business to cure you, but I sure work hard to really improve your quality of life, whatever that is for you. It may be a very simple thing, like you want to be able to go on vacation with your grandkids, or it may be complex where you don't want to retire from your company. So again, I'm going to develop a protocol with the help of my wonderful physicians to really look at where can we help this patient meet their particular goals. And in doing that, I really need to study their previous lab work, their previous notes, their radiology. We need to look at all of those things. We just don't plunk you in the chair. That's the difference between what we do in a spa.
We have a call, Richard in Summerdale. Richard, good morning. You're on Health Watch with Dr. Molly.
Hey, good morning. I saw Doug Sittel, S-I-T-T-E-L on
Oh,
Google.
thank you for the call.
Thank you so much.
Thank you for the call. Thanks a lot. Is the Lyme disease consultation,
Yes.
let's say you determine that the patient has Lyme.
Or has post-Lyme
or
many
post-Lyme,
times.
whatever the Lyme situation
Right,
has to
right.
be. Is that different than an initial consultation for something else?
Well, it may be much more complex, because a lot of these people have been gone to countless physicians, countless clinics, including integrative or holistic or whatever, and they're still suffering the ravages of this. And the interesting thing is, because there are so many systems in that particular condition that are affected, John, so you really are looking at some of the rheumatoid issues. You might be looking at some of the fatigue issues. You may be looking at things, abnormal test results that could lead you down another rabbit hole. So the bottom line is that's a more complex kind of condition. And also, I'm going to tell you something. The pain issues sometime in Lyme can be something like systemic pain, and you almost think, oh, are they suffering from an autoimmune disease in addition to the post-Lyme, like RSD or something like that. So there's plenty of it, like regional syndrome pain. So again, it is going to be a little more complex. So I do usually need a little more time than 20 minutes.
Okay. I was going to say, the next time you have a 20-minute consultation will be the first time.
Well, I really try.
Yeah.
I really try, because I really have to see all our patients in the chair as well.
Yeah.
You know?
When it comes to the Lyme disease or any
Autoimmune.
Whatever it is, what is the prognosis for? Are they going to come forever?
Well,
or what?
John, that's the question I get all the time. I always tell people, look, I have no intention of allowing you to go steady with me. I said my objection is my whole goal is to help you get to a quality of life that you can maintain. So many times you might have to do 20, 30 treatments. And I have people like you, I do, because they come in every week when you're there
That's right.
to chat about other things, okay, who are with me for quite a while and want to do this because they want to maintain their reserve. And so it is a dicey thing. We've got to talk and see where you are. But I can tell you this, as I tell them, look, you want to go on vacation. You've gone on vacation.
Yes.
You want to have some fun in your life. Absolutely. I am not tying you down to the chair. However, I will say to you that I want you to be prudent in your health care choices.
All right, we are coming up on our first break of the morning. The show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. If you have a question for Dr. Molly, now's a good time to call. We always tell you call early so we don't we make sure we can get your call. 855-839-1210, 855-839-1210. It's Health Watch every Sunday, 8 till 9 on Talk Radio 1210, WPHT. I'm your host, John DeMasi. Dr. Molly and I return after these words. We are back here on Health Watch. Operators standing by right now at Innovative Medical Associates, and the number 856-489-0505. Again, 856-489-0505. And if you want to check out the website, a lot of good information on that. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. And the show is Health Watch right here on Talk Radio 1210, WPHT, every Sunday, 8 till 9, here on the station. 855-839-1210 is our number here in the studio, 855-839-1210. And a big part of your practice, Dr. Molly, is cancer support.
Yeah, cancer supportive care, unfortunately. And I think I'm seeing more and more of that. And so from the perspective of where I sit and my wonderful physicians sit, we talk about this all the time, like, why is this happening? But there are nutraceuticals or natural substances that can help support a cancer patient through whatever they're going through. And in some cases, the behavior of the malignant cells depends on a lot of different factors. Okay, it's not just one thing. We always talk about vitamin C, as one of the things we use. And indeed, they're using it both traditionally and non-traditionally. But they really depend on many factors. And saying that, what happens is the cells, the cancer cells, or the cells themselves, the malignant cells, tend to mutate. And what happens is they multiply abnormally. And what happens is they mutate by having a dysfunction in their cell signaling to each other. Now, get that, in their cell signaling to each other. So somehow when the cells signal to other cells, they know what to do. And that usually God has given us this innate ability to manage new cell growth without overabundance of cells, which is cancer,
yes.
Right? And what we found is that there are nutraceuticals have been shown to affect the cell signaling in a way that may cut off the malignant cells from some of the other elements or cofactors that they need to multiply incorrectly. So this is something that I'm very interested in utilizing in our support of patients. And actually, it's exactly what is being used traditionally. Traditional oncologists want to shut off that cell signaling. That's what they do with the chemotherapeutics. That's what they do with the immunotherapies. So we know vitamin C works. But vitamin C, along with another particular vitamin that is man-made, has been actually approved for compassionate care. So it's vitamin C and vitamin K that reduces cell signaling. And they have it as a true, I would say, chemotherapeutic IV in traditional settings. However, they only make it available to people in the term compassionate care, which means they have to go through everything else in order to get it. So we use a variation of that. You can't secure, you can't secure the particular component that makes it a drug, so to speak. But we use a different type of therapy that tends to mimic that. We also use milk thistle. Milk thistle. It's extracted. It's very good for the liver, for the cell signaling in the liver. We might use quercetin. We use, believe it or not, spirulina, which is like the pond, you know the green stuff that's above the pond?
Yes.
Yeah, we use that. That also plays a role in stopping the cell signaling. Melatonin, John. Melatonin is an interesting nutraceutical because it's high antioxidant. People only think about it in sleep, but it's really good in cancer supportive therapies.
So all of these things are used.
Yes.
So could you just load up on vitamin C and vitamin K?
Yeah, well, you don't want to load up on vitamin K because vitamin K can also affect clotting.
Okay.
So again, you want to use things judiciously, right?
And that's where you come in.
I hope, and what we do in the clinic. Pancreatic enzymes, very, very important. That helps slow down cell signaling between the bad signaling. Coenzyme Q10, something I love. And we actually have a way by which we can deliver coenzyme Q10 through the IV as well as injection. So there are various forms of CoQ10 that actually work. And then again, I love the antioxidants. But when you go to the cell signaling, I want to really get into something called the liquid biopsies. That's the next thing.
Okay, now explain that, liquid biopsy.
Liquid biopsies. People come into my clinic and they start talking about this. And, of course, I'm excited by that, being a chemist that I am. Liquid biopsies is, quote-unquote, detecting cancer in the blood, all cancers in the blood, or many number of them. I'm not going to say all. And it's a detection type of test. So what it is a screening test. It's a screening test. It's actually being used in many of the systems right now, believe it or not. It's not talked about much, but it's becoming more and more popular because our listeners are reading more and more about it. And what it can do, it can detect more than 50 types of cancer through a routine blood draw, with a low positive, false positive rate of below 0.5%, John. 0.5%.
Wow, that's good.
Okay.
Yeah.
So when a cancer signal is detected, so what is it looking for? It's looking for what I was talking about earlier, the cell signaling to each other, that dysregulation in that cell signaling. Okay, so the test predicts the origin of the cancer cell with a high accuracy to guide the next step to diagnosis. So you notice what I'm saying. It's a screening test. It's not a diagnostic test. It is a helpful test.
But it helps to diagnose.
It helps put you on the road to look into this more thoroughly. Okay. Because if you have a positive test, with a 0.5% of false positives. That's a low number, folks. And by the way, they did an entire study on this with many hundreds of patients, okay? And the test has been approved by CLIA and the powers to be here in the States. For patients at an elevated risk of cancer, you really want to look at that, and then you want to guide your patient into what? More diagnostics. How is that done? You send them to the proper physician for everything you need to look at in terms of wherever the origination of this particular signal is coming from. Do you follow that?
Yeah,
if it's GI, yes, it's a little complex.
Yes.
If it's GI, I want to send them to a good GI guy who may ultimately send them to a GI cancer doctor, right? If it's a woman's cancer, I want to send them to a GYN, right? With the results of this test. So we can use this on many of our patients who come to us who have even had cancer in the past and are worried about a reoccurrence. This might be a great screening technique. And again, I'm going to emphasize screening. You don't want to use this. We advise the patients to continue all other traditionally recommended screening options, right, at appropriate intervals. So, for example, I can tell you that a very important portion of this is a very timely clinical evaluation by a qualified physician, right?
Yes.
Okay, that makes sense, right? But this is a wonderful thing. It's a screening test. It doesn't confirm the presence of cancer. It's telling us there's a signal happening. So guess what? Think about how early that can be found. Early. So, do you think that has helped the patient? You bet. I saw it firsthand.
So, when did you see it? In other
I'm
words,
going
you saw this.
I'm going to tell
firsthand?
you. I had a young patient, a potential patient, come in and said they had a history in their family of cancer, but they never had any symptoms. None at all. They felt good. They had energy. They did all this. But, they said, you know what, Dr. Molly, maybe you ought to do some vitamin C. I want to sign up for vitamin C. Okay? I said, great. I said, how about we think about doing a new test that's out that's called the Galleri test and the Galleri test, and we look at this and possibly make sure that there's no cell signaling going on. Well, she said, okay, fine, great, I'll do it. Guess what? It came back that signaling was detected. Now, I've got to tell you, I stood up, my hair in the back of my neck stood up, because I really had to say, all right, now I got to get her to a really good GYN, because she thought she had fibroids, only fibroids. She was told that when she was 18 or something, and now she's like 25, 30. And guess what? This thing raised the possibility that maybe she's actually got something like an ovarian problem or a uterine problem. So what did I do? I sent her to a GYN who is a friend of the clinic. The GYN did her screening test and said, Dr. Molly, you're on to something. I'm sending her over to a GYN gynecologist.
And that's...
There you go.
There you go.
So now she's back in the chair for vitamin C,
Yeah.
by the way. She's doing well. So this kind of test can be used for patients of almost any age who are in relatively good health. I mean, you wouldn't want to use this on a 90-year-old who's suffering from emphysema and is near the end of their care. I mean, you got to be smart about this. But for people, this is a wonderful, wonderful thing to really give us a jump on what possibly is brewing.
21st century medicine again.
I say that all the time. And I say that this is something that, as long as we continue to do the traditional follow-up diagnostic procedures, guess what? That's a wonderful thing.
Yes, it is. We are coming up on the halfway point of the show. Boy, time flies when you're having fun. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. If you have a question for Dr. Molly or a medical challenge that you want to run by her, 855-839-1210. We still have plenty of time to take your call, 855-839-1210. It's Health Watch, Sundays 8 till 9, Talk Radio 1210 WPHT with Dr. Molly Fantasia. I'm your host, John DeMasi. We both return. More of today's edition of Health Watch after these words. We are back here on Health Watch. Operators standing by right now at Innovative Medical Associates. And the number, 856-489-0505. That's 856-489-0505. When you call, if you want more information, they'll be happy to give it to you. But most importantly, you book that initial consultation with Dr. Molly. It is complimentary, and it's really what you'll find that you can really find a lot of information on that. And whether you want to move forward or not, that's how you'll make your decision. 856-489-0505. And the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Health Watch is the show every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We're going to the phones, talking to one of our favorites, Frank in the Northeast.
Well,
Frank,
John,
good morning.
John, Frank actually beat us to the punch, right?
Yes.
We were just talking about you, Frank, honestly, in a great way. I said I need to send a shout out to you because I tried to honor your request to get you a good neurologist, and unfortunately the health system pulled a fast one on me and took her out of general neurology and put her into a specialized. So I wanted you to know we're still working on that, Frank.
That's what I was calling for.
I knew it. And I, honest to goodness, if John, did I not
Yes,
say
that's
this?
right. We were scheduled
in
to
fact,
talk about
I
it.
was scheduled to talk about it, but John and I got into this lengthy conversation about cancer. As you know, I see a lot of cancer patients, but I don't want you to think we put that to the back burner. We didn't. What we found is they're streamlining the neurology department, and that what they're doing is they're taking patients with particular neurological conditions, like my doc has, who has MS, and they moved this wonderful neurologist into what is an MS specialty. So it's a subspecialty within the neurology practice. But don't lose hope. I'm hoping by the middle of the week I'll get somebody for you.
Hey, Dr. Molly, get this. It's even worse than that, because what you said is correct. I called up on Tuesday. Barbara called me on Monday.
Yeah.
Have to see a general neurologist first. That's not till February of next year, right? And then after you see him, then it'd be about another year before you can see her.
No, you know what? I'm going to try to cut. Listen, we're going to try to get you in before the year. Believe me, I knew that would happen. But it's the way they streamlined the practices now. You know, Frank, more and more people like you and other people who are intelligent are getting fed up with the big systems, the big monoliths. They've got their protocols in place. They know how they want to ring the chimes. And unfortunately, we're seeing more and more of that. Because, you know, I have several retired physicians, you know, who come to me as patients. And if you saw these guys and gals who are so disgruntled, you know that. You were a nurse. Come on. It's just unbelievable. So.
But Dr. Molly, can I run something else past you?
Sure. Why not? Come on.
Well, this problem started in 2000, but then all through on different doctors, different points of views, from acupuncturist, chiropractor, to medical doctors, to specialists. But some people say, like, my legs because of herniated disc in my lumbar, and the problem in my arms because I have herniated disc in my neck, too. It kind of makes sense. I don't know. What do you think?
I think it kind of makes sense. It kind of makes sense because the problem is you don't have one particular symptom. You know what? You have a couple that are pretty dire. And I think it does make sense. And I think you were smart to seek out a neurology consult. So I really think you're going to start there. And, I mean, you've gone to every autoimmune specialist that I can think of for the rest of this, Frank, you know. So I'm with you on that. And just let us try to do our job. I want to get you in quicker than a year, though. And may God bless you.
Thank you, Don.
You're the best.
Have a good one. Thanks again.
Thanks,
Frank. Thanks for the
that
call.
really was a true thing. I mean,
Next February.
Yeah.
Next February?
Yeah.
Really?
Welcome to my world. Do you see why I want to do early detection tests?
Yeah.
Okay. So, John, I just want to end with this test because I said it really looks at early detection signaling across 50 types of cancers through the simple blood draw. So we're looking at adrenal carcinoma, we're looking at appendix, that's obscure, bile ducts, bladder, cervix, colon and rectum cancer, okay? So let's say we have a positive in the colon and rectal cancer, and maybe they had a negative with the Cologuard. Guess what? I'm still going to send them to the rectal specialist. You know why? He or she needs to have a colonoscopy, right?
Yes.
Okay. So, I mean, these are the things that can be done, and they work hand in hand with a clinic like ours,
This is called the Galleri test?
Yes, Galleri.
Okay. And this is all the things that you've been talking about.
Yeah. And so we can do things like esophageal, gallbladder, gastrointestinal, kidney, John, something near and dear to you and me, liver, lung, larynx. Let's talk about, melanoma, Merkel. By the way, I had one case of Merkel in all 27 years. It was horrible. And again, it was just the kind of thing that the only thing we could do at that time, which was 5-6 years ago, was send them to a specialist in Merkel, which was very rare at that time. And that patient really, really suffered through chemo and whatever, but we kept them going for quite a while. And he said that he just enjoyed being at our clinic on those days because he had ended up having some quality on those days because the chemotherapy was so bad. Neuroendocrine, oral cancers, pancreatic, prostate, soft tissue sarcoma of the abdomen, and thoracic, soft tissue sarcoma of the head and neck, and other soft tissues of the trunk and extremities, right? So this is a good one, right? Because we had a personal interest in this, I'll tell you. Stomach, testes, urethra, vaginal. So you can see, John, this screening test is just a particular roadmap to the next step. And what I love is we're able to bring our patients back in and say, okay, we can help you, and we can then become your advocates also while you're going through the traditional cancer journey, if that's what you want to do. If you don't want to do anything, I'm going to really try to talk you into something.
Yes.
Okay, at least the confirmatory tests.
Yes.
Because that would make me sleep better at night.
Yes. They always say early detection is the key.
Yeah.
And this is really the key. Because
Yes.
this test is earlier detection, I would think.
Exactly. If it comes back, and we've got to look at it, not if it comes back and it isn't detected. You still got to really say to your patient, if you have a strong family history of some kind, or you've had a previous cancer, you need to make sure you go for your traditional screening. And I am a very big proponent of doing everything conventionally in terms of the screening and the diagnostic testing that needs to be done for you to continue your cancer journey and make sure that you're A-OK.
So this test is just a part of
an overall program that we would do for a particular patient. Look, it's going to reduce the number of people or the incidence of diagnosis with late-stage cancer and cancer-related deaths across the variety of cancers. There's no doubt.
Well, that would seem to be important.
Right,
Yes.
and more we're going to see traditional places. Actually, there's a very big clinic right now in Ohio that's using this extensively within the framework of all of their pre-testing for cancer patients. So again, it's a screening test, not to say, hey, listen, you can go home and say, I'm cancer-free. We're not saying that. We're saying you're free of the signal at this time. But guess what? That's a big step forward to 22nd century medicine.
Okay, so they're cancer-free at the moment.
They're cancer signal-free.
Is free, okay,
right.
but
Listen,
not necessarily cancer-free forever.
Exactly, and that is powerful in and of itself, because I'm going to tell you, it's not covered by insurance, but I don't put any markup on this test for my patients. Nothing. We send the test into the company, and it's paid. Actually, I ran this test on one of my religious people this week, and we're waiting to see what hands back. She had a history of cancer, and she doesn't want to go back to the GYN doctor because it's uncomfortable for her to continue to have the testing, and she feels that it's bothersome to her. So this is giving me something to at least say, look, this is something, but it may not be enough.
You mentioned there are some nutraceuticals that can work.
Oh, yes.
And you said milk thistle.
Milk thistle, absolutely. On liver, cancer, yeah.
So is that an option in addition to this?
Of course. What we do, if you have a history of this or we're working with you, we're going to use certain nutraceutical. I think, John, you and I get carried away on vitamin C because it's so good for so many things. Yes. And it works sort of indirectly, both pro-oxidant and antioxidant, which we know is good for cancer. But there are so many other of God's ingredients out there that can help people through some of these more deadly cancers. For example, I have a patient right now who has liver cancer. Well, you bet I've put her on the milk thistle extract, which I'm using. And again, I want to encourage people to understand, it's not just the product, okay? It's not like just the frankincense because it has some mystical properties, although it certainly has God-given properties. It's the constituent that God put in there that does the trick. It's the constituent and getting enough of that therapeutic value. If you don't get enough, it's not going to stop it. It's not going to stop the cell signaling. And again, I'm not saying this is a cancer protocol for everyone. It isn't. But you know how many people I have who said, I've done chemo, I'm not doing it again, I want to do a more natural approach. I say, okay, I'm going to do the best I can for you in that regard.
We are coming up on our final break of the morning, which means you still have time to call in with a question or two. 855-839-1210. 855-839-1210 is the number. It's Health Watch. Dr. Molly Fantasia is here, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, 855-839-1210 is the number. I'm your host, John DeMasi, with Dr. Molly Fantasia. We're both returning with more of today's Health Watch after these words. We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates, and they'll be there well after we leave you at 9 o'clock this morning, but you can call now. 856-489-0505 is the number, 856-489-0505, and the website, innovativemedicalassociates.com. InnovativeMedicalAssociates.com is the website. Check that out as well. A lot of good information on that. And we should remind you that in case you missed any of today's show or you want to just hear it again, it's the Health Watch replay this afternoon, 4 until 5, right here on Talk Radio 1210 WPHT. But it's the live version right now. 855-839-1210 is the number. Right here in the studio, 855-839-1210. Going to talk about some patients and their updates.
Oh, sure, John.
And we do this because we just kind of show other people how things work or at your clinic.
John, you know, we were talking during the break. You said, oh, I spoke to that nice gal who came in with her son and daughter. I said, that's right. This is a family that has a multitude of problems. The kids are both post-Lyme. And
they're young, too.
Very young, 25, I think, and 18, 19.
Yeah.
So the bottom line is it's a post-Lyme syndrome, but it's more than that. They had mold exposure. I ran the test. They had a mold exposure. The mom and dad run several retail stores. The poor kid, he comes in from Staten Island, right? They're all coming in from New York. And they've gone everywhere, and no one wanted to treat the kids for the mold. And they certainly said, look, they cured the Lyme disease, which they did. The Lyme titer was negative. But both kids are suffering from joint pain. Imagine, you're 20, joint pain, intermittent pain in like the knees, and neurological, the brain fog. How can you have brain fog at 25 years old? Come on,
that's
John.
Really unbelievable.
You know. And the problem with this case, or the challenge for me is, yes, we're going to run the post-Lyme protocol, but I also have to make some nuances in that because of the mold exposure. So it's a two-prong approach I've got to take, you know. I say what we do is we go after the post-Lyme first. But in addition, we've got to also help them with the Lyme because the Lyme is affecting their breathing. They're on puffers, and it's just a mess.
Yeah, and the young girl is 18, right?
Right. Yeah, she's a kid. I mean, it's unbelievable. And you know what? The doctor told the mother it's in their heads. Well, they actually tested.
Where have you heard that before?
Yeah, every day I hear it. But you know what's interesting? They brought in the original Lyme test. They both tested positive. It seems like these folks just don't, and it's a big system up there in New York, does not want to believe in the post-Lyme syndrome, which I absolutely believe these two kids are suffering from. But in addition, it's compounded by environmental exposures.
Interesting. The mother was talking to both of us the other day, and she said, it was really amazing how I found you. Because one of the Amish who comes in, recommended this. She said the Amish gentleman said you changed his life,
yes.
And so she said, I've got to go there. And she booked an appointment immediately.
Yeah. She's a very lovely woman and very smart. She has done all the research on post-Lyme. She was totally surprised about the mold. She had the house tested, John, in addition to when I told her that the kids came up positive. And guess what? She said, I have mold all over the house.
Jeez.
So the good news is she's having that remediated, and we're going to go from there.
You have another patient, a
33-year-old gal with breast cancer, and I've spoken about her before. She was born with a particular neurological issue, and it was hard, but she's doing very well. She's also seeing the oncologist that is a friend of our facility who does an integrative approach to the oncology. She's doing very well. She had a little problem while doing his treatments where the white blood cell and the red blood cell count went down. I changed up the protocol for the supportive care. He called and told me she's doing well, and her father said, wow, we're just so thrilled that she's doing this well.
And guess what? The lovely Linda is on the line.
Oh,
the
no.
lovely Linda. Good morning and welcome. You're on Health Watch with Dr. Molly.
Hi, Linda.
Good morning, John and Molly. How are you?
Good, baby.
Good.
How are you doing?
Good.
Good. I was just listening to you guys as I do every week, even though I know you in and out. I love listening to you, Dr. Molly.
Okay.
I just wanted to thank you. I broke the top of my foot Christmas time.
Yes.
Okay,
yes.
4 months ago.
Right.
You told me, why wouldn't you get some peptides?
Right. You're in the
I only
office.
had 4, maybe 5 peptides.
Right.
My foot is healed. I'm just
There's
telling
no
you,
question.
the peptides for bone.
Right.
And
exactly.
it's healed.
I know. And guess what?
Patients were upset. I was in a boot all the time. They're like, "What is wrong with you?" I said, "I don't know. I'm too old."
No. You know what I said? We're like the gang that can't shoot straight, right? We're like the shoemaker with no shoes. I said, all of us have problems, and nobody's utilizing what we have. Come on. We've got the wealth of knowledge here. Let's use it.
So you said you were sick of me in the boot. You were so sick of me in the boot. You gave me the peptides. I don't know if it's 4 or 5, Dr. Molly. I don't know.
I
It's
think
4
it
or
was
5.
four treatments.
But I'm out of the boot. I'm in my sneaker, and here I am going again at my old age.
Thank God. And you better pick me up at the train tomorrow. That's what I know, because I'm coming in.
I have it on my step to pick
I'm
you
coming
up.
in to liberate my car. Okay, so make sure,
know.
Linda. I need you. I need
right.
you out of that boot. Thanks, Linda.
I
That's
know.
great.
Love you
That's a
guys.
true story, guy.
Linda, don't fall again. Don't fall, please.
I know. God
I
bless.
know.
That's
I know.
a good little story.
Thanks
Good
for the
story.
call.
Thank you. Okay, we're doing
Well, that's like the shoemaker
I
who
said,
walks
man,
around
what
with
are we
holes
gonna
in
do?
his shoes.
What am I going to do, John? That's how we are. We get so wrapped up in our patients sometimes, but I will tell you that I have a wonderful, wonderful group. I am so lucky that everyone co-ops with me. They do such a great job, John, my people.
And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at 856-489-0505. That's the number for Innovative Medical Associates. And you want to call and set up your initial consultation with Dr. Molly. It's complimentary, but you will learn a lot. 856-489-0505. And the website, innovativemedicalassociates.com. InnovativeMedicalAssociates.com is the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, again, geez, twice in one day, and our nursing staff, Barbara, Lana, Catherine, and Donna. There is Joanne and fabulous Fran, delightful Dee, and our nursing assistants, Karen, Kathy, and Sandra. I'm your host, John DeMasi. Thanks for listening. We'll talk to you next Sunday, Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.